Welcome back to the Daily Drum on WHUR 96.3, 96.3 HD2, and SiriusXM Channel 141. I'm Bramante Bryant in for Harold Fisher. This is the Insight segment. Well, it's a Medical Monday, and tonight on the Drum, it's an illness that impacts 1 in 6 Black men yearly. And sadly, the disease will claim the lives of thousands of those men. September is Prostate Cancer Awareness Month, and tonight it's time to talk, learn, and take action to turn those numbers around. My guests are on the front lines working to do just that. Dr. Pamela Coleman is a professor in the Department of Surgery in the Division of Urology at Howard University's College of Medicine. And Kwesi Neblett is the creator of hashtag Black Prostate Check Challenge, an effort to bring community leaders, policy experts, doctors, and others together to guide Black men through the prostate cancer treatment. Dr. Coleman, Mr. Neblett, thank you so much for being with us. Now, here's a couple of facts that we should sort of just put out there with September being Prostate Cancer Awareness Month. As I said, 1 in 6 Black men will be diagnosed with prostate cancer this year. That's compared to 1 in 8 white men. Black men die from prostate cancer at twice the rate of white men. Black men are less likely to be covered by insurance, and Black men are less likely to be enrolled in clinical trials. Dr. Coleman, let's talk about those statistics. They are daunting, and the risk factors and the plight that Black men are facing when it comes to prostate cancer.
Thank you, Mr. Bryant. Those risk factors are daunting, but I think that we can certainly make some headway in reducing those risk factors in shows like yours, talking about prostate cancer, getting the word out there, and particularly getting Black men to be evaluated for prostate cancer.
Dr. Coleman, we know it's tough often to just get men to go to the doctor. That may seem like a stereotype, but I think if you ask a lot of the women involved in men's lives, especially Black men, they will tell you it's hard to get men to get to the doctor. So is that also a big issue that we're dealing with, just getting men to come in and be diagnosed and be tested?
Yes, that is an issue, but I have some good news for men out there that in terms of diagnosing prostate cancer early in the screening phase, right now we've kind of simplified it somewhat to getting just the blood test done. So as you would go in and have your blood tested for sugar diabetes or high cholesterol, you can ask your primary care doctor or physician urologist to check your prostate-specific antigen or PSA blood test. This is a screening test for Black men, and we start screening Black men after the age of 40. Certainly there's a family history. But it's nice that you can have the blood test done. I know there was a fear before the digital rectal examination, and we do still do the digital rectal examination. But doing the PSA blood test is a very good screening test, very sensitive, very accurate.
Is one more accurate than the other? Because we know the stigma of doing the rectal exam. A lot of men just, aren't comfortable with that.
Yes.
So is the blood test as accurate?
Oh, yes. The blood test is much more accurate, actually, than the digital rectal examination. The blood test is very sensitive. The digital rectal examination gives us an idea of maybe size and the texture of the prostate. But the PSA, if I can just leave one summary statement, if men can just come in and get their PSA blood test done, that would be great.
Kwesi, you've launched an initiative to bring, as I mentioned at the top of the show, all together to guide men through the prostate cancer journey. Tell us about this effort that you're spearheading, and it's a personal effort, right?
Okay. Yes, thank you. I mean, that's actually an excellent question. Thank you for having me, Bramante. But yes, the effort is to do exactly what we're doing now. Is my father. His name is Charles Delbert Neblett. He was a civil rights activist, an icon, and singer, an organizer. And we found out this year he had stage 4 prostate cancer, and it has metastasized to his bones. So when we was looking for the questions and I saw these different things, and I saw and go through the process and getting the right doctors and everything like that. We had more questions than answers, and so it became like a trial by fire. We was trying to figure things out as we go, and we both know Dr. Coleman knows that it's between time and money. That's the fight that we're dealing with. Is understanding that we don't have that much time to play with cancer. We have to get on top of it and address it accordingly. And with that being said, we came up with this idea or with me and a few other people. We talked about it. We said, hey, if we have those issues, we have these questions. Then a lot of other people does as well, and especially a lot of African American men, because we all understand the disparities in the medical industry when it comes to African American men, that we don't have a lot of trust. We don't have a lot of dialogue. There's not a lot of outreach from the medical industry to ensure that we're getting addressed accordingly in the proper ways and especially with the disparities that we have a long history dealing with. So now we're in a position to where we want to reach out to doctors, the politicians, the policymakers, community outreach, and to making sure that we can have this dialogue that we're having right now, and clearing up some of the stigmas and the myths. Because what the doctor just said, we can do a blood test now more than the rectal exam. As I think that takes a load off of a lot of men's minds, because the one thing that we don't want to do is that exam to even figure out if we even have an issue. And I think that is a beautiful thing that we just found out this morning, that is something that is a viable option into making sure that we can get ahead of this way before it gets to the time frame of being stage 4 or anything else.
And I want to get into a little bit more of that, because you hit a lot of topics in there, especially the stage 4 and the survival rate. But I did, before we go there, want to go back and just ask you a question about your father. I know he's in stage 4. Did he fall into that category of waiting too long to be tested? Or, because I know if you catch it early, and Dr. Coleman, you can talk more about this as well, that, the survival rate of 10 years plus is at about 95%. So with your father, where did he fall in terms of being tested?
Oh, my father, what happened was he had prostate cancer before, and it went into remission. And what ended up happening was this year, when he did not get tested for a little while throughout the beginning of the year, and then when he got tested again, they came back with it, said it not only came back, but it metastasized. So it was I think it was the treatments or the tests that they done before, it was not comprehensive. So they did not catch it coming back fast enough. And so then now when they hit the stage 4 and it metastasized, it becomes a different ballgame. Okay, once it starts spreading, it's no longer something local. It's something that now you have to address it more aggressively. And that's usually what ends up happening with a lot of African American men, that they don't catch the symptoms or they don't see any symptoms until later on, the stage 4. And then when it gets to stage 4, then that's when it becomes a serious situation. And once it metastasizes, like my father's, it becomes a more aggressive form of cancer, because now you're not just dealing with the local issue. Now you're dealing with you're dealing with multi locations and sections.
Dr. Coleman, for African American men, are genetics involved here, or is it more an issue of access to being diagnosed and going in and making sure you're making your yearly appointments?
Thank you so much for that. And a number of issues were touched on. I'm sorry to hear about your father, but I will say that he can be treated. He still can be treated for his prostate cancer. But if we do catch it early, probably more than 99% of men will be alive at 5 years if we can catch it early. Now, a couple of points that you made, first in terms of his initially having prostate cancer. So it's very, very important for men to take away that when you have prostate cancer, you do need to be followed. Occasionally, people will have diagnosed with prostate cancer, they will receive treatment, but they still need to have follow-up. if nothing more than just a PSA blood test. And again, just the blood test once a year. The other takeaway point is for those who get the PSA blood tests and don't have cancer, you still need to be followed up because the PSA can change over time, especially as you grow older and more mature. We can have a baseline PSA, let's say when you're young at 40 or so. And as time goes on, we want to follow that PSA on a yearly or biannual basis to make sure that it's not increasing. So unless you have your prostate completely removed, and even then, when people do have their prostate completely removed, there could be residual microscopic disease that needs to be followed. You should keep in mind of having your PSA done. Now, on the issue of genetics, and this is important, probably around 10% of prostate cancers are genetic. So that means if your father or your brother or uncle, someone was diagnosed with prostate cancer, that should make you even more sensitive to go and have your blood test done. Sometimes there can be a problem with access to care. You may think that, well, I don't have a primary care doctor, or I don't have insurance, or different things. But there are programs that are available now. Say at Howard, we have a Men Take 10 program where we offer free prostate cancer screening, free PSA, and so that can be done. And then once you have that done, and you need further access, insurance coverage, we can get you pointed in the right direction for that. So there are ways, and I think the first thing is talking about it. Getting it out there. A lot of times, people will say, "Well, there was cancer in my family," and they may not know what type of cancer there was. But just getting the screening test done, and this actually segues into women because there's a connection, genetic connection with prostate cancer and breast cancer. So if there's a family history of breast cancer, directly immediate family, we can do screening and testing for prostate cancer in men, and also looking for a genetic gene, the BRCA1 gene and 2 gene in women. And then that can even go on looking for other genes for ovarian cancer and things like that. So there are genetic incidents of prostate cancer. And again, or if you hear someone in your family has cancer, colon cancer even, then that should be an eye opener to go and get checked, to get tested.
Kwesi, in the minute we have before we go to break, and we can sort of pick up if you still have more time to comment on this, as part of your effort, are churches, you're talking about community groups, and so are you reaching out to as many as possible, and do churches play a role in bringing awareness to the community and part of the effort that you're doing to bring to the African American community and Black men particularly about prostate cancer?
Yes, thank you for that. Churches, as we know in our community, play a big role. And so we will have screenings and things taking place at churches, also at barbershops. So we've been known to go inside the barbershop, talk a little bit. Now, I may not always go, but I will say women, we are the ones that bring our men to the doctors sometimes when they don't want to go. So women can also be invested in this whole screening issue and get our man to the doctors in terms of getting checked for prostate cancer. So our community groups, our activist groups, our church groups, our barber shops, and we'd like to actually even get into football. Now, I know how many men are going to be watching football tonight, right? Yeah, I know.
Yeah, we'll be watching.
The Commanders, okay, whatever. But still, and I'm a Washingtonian, so I like my Commanders. But it'd be nice to have something, even doing a commercial talking about prostate cancer and making it become more aware so guys will get out and get checked.
Before we go to break, and when we come back, Kwesi, I'll let you on the other side chime in on that as well. But I want to give you both a chance to let our listeners know if there are resources, websites, organizations that they can go to get more information. Dr. Coleman, I'll let you go. We've got about 40 seconds.
Okay, 40 seconds. I'm going to put a plug in for Howard University Hospital because I'm director of the Men Take 10 Center. We say men take 10 minutes, and not even 10 minutes, but just to come in so we can get your blood test done. We can do a little education on you about prostate cancer, and then we get back to you about your results. So you can get the screening done right here.
And Kwesi, any resources you would recommend folks to go to?
Yes, I would say this. On all social media networks is hashtag Black Prostate Check Challenge. And if they go to there, we are putting up and we're constantly informing people, letting them know where to reach out to. and actually individually helping them in a sense, because everybody's situation is different. Not everything is for everyone in their, and what, but depending on what stage they're in, depending on the situation they may have, that it requires a different set of gloves. So if you go to hashtag Black Prostate Challenge, we will definitely help out and give you that information.
All right, folks, we're going to take a break, but don't forget you can hear every edition of the Daily Drum Insight segment via podcast on WHUR.com, or you can download the 96.3 HD2 app on your smartphone and hear the program live in its entirety. This conversation continues online and on SiriusXM channel 141, 96.3 HD2. The original Quiet Storm is next on 96.3 WHUR. Welcome back to the Daily Drum on SiriusXM channel 141, 96.3 HD2. I'm Bramante Bryant in for Harold Fisher, and tonight we are talking about prostate cancer and bringing awareness to it, and specifically the issue and how it envelops Black men. We've talked a little bit already about the rates of prostate cancer, Black men versus other groups. 1 in 6 men, especially Black men, will come down with prostate cancer, and the mortality rate is about double for Black men than others. Some we've seen 4 times as high as others. Our guest tonight, Dr. Pamela Coleman. She's a professor in the Department of Surgery and Division of Urology at Howard University's College of Medicine. And Kwasi Neblett, he's the creator of hashtag Black Prostate Check Challenge. It's an effort to bring community leaders, policy experts, doctors, and others together to guide Black men through the prostate cancer treatment. And Kwasi, I wanted to ask you, you didn't get a chance to sort of comment on the other side when we were talking about the groups that you are trying to connect to get folks more tied into what is happening in terms of prostate cancer awareness. Can you talk a little about that?
If you can repeat the question once again.
I wanted to get a little bit more of your thoughts on what your challenge is in terms of bringing in different groups, making them aware. When you're talking about reaching out to the community, you're talking about churches, you're talking about men's groups, you're talking about fraternal organizations. Can you talk a little bit about that outreach and who you're trying to connect to?
Our outreach is multi-layered, because we're dealing with a span of men from the age 30 in their 30s all the way on up. So we have to reach them where they are. And one of the major things is starting off with the guys that are a little bit younger in their 30s, to try to give them the education, understanding what they need to be paying attention to, especially at the early stages, so we can catch them before they even get to the point of having cancer and or having stage 4. Also, yes, reaching out to churches, barbershops, like doctor mentioned before, and going to those locations, getting them online, going to those programs and organizations, and actually tap into organizations where men are talking about their health, and there as outreach, nonprofits. We love the idea of reaching out to the women in the community, because the women in the community also have fathers, they also have sons, they also have uncles and nephews, and different things that they need to be attentive to. And that's also helped dispel the issues and the myths of prostate cancer, that you're in it alone. This is a community effort. This is something that we want to make sure that everyone.
Okay, I think we lost Kwasi for a second. We'll have him come back in a minute. Dr. Coleman, I don't eat as well as I should. I know I eat too many sweets, too much fast food, probably too much fried food. Can you talk a little bit about our diet, our exercise? Can that impact us getting prostate cancer, or at least keeping it at bay?
Certainly can, Bramante, certainly can. Thank you for bringing that up. I mean, there are so many things. Sometimes we eat for what we like to taste and what tastes good to us, but not necessarily what is good for us. And so having a high-fat diet, a diet that's low in vegetables, not exercising, So let's swing it around to the positive. Let's look at our diet. Let's try to make it a less than a high-fat diet. Let's exercise more 3 times a week. But if you haven't exercised in a while, first make sure you get checked out. Make sure that you're in good condition. Don't try to go out and run a marathon in one day if you haven't been training for that. But high-fat diet, exercise, knowing what to eat, where to go to eat. Now, we have access. We've talked a little bit already in terms of the internet and things that people can go to. And you can actually, Google some of these things and look at it. You can use artificial intelligence to look and see what's going to be good for you. And then by all means, speak with your doctor about it, what you need to be the type of nutrition plan. Because I don't want to say necessarily diet, because we're not necessarily looking to lose weight, but we're looking to have a better nutrition plan. And in terms of doing that, we may have some loss of weight. And it can be as low as 10% loss of body fat, can have immense measures in terms of your overall health. So yes, that's a very good indicator. It's part of like when I give men a sort of a quiz about prostate cancer, because prostate cancer in its earliest stages does not have any symptoms. Some of the symptoms that we see with men that are having problems urinating, getting up at night to urinate and controlling their urine, those are more with enlarged prostate, and the two do not cause each other. I mean, they're connected in that they're both coming from the prostate gland, but some of those symptoms or blood in the urine are not necessarily meaning that you have prostate cancer. Now, that should bring you in to be examined by your physician so you can have your history done, physical exam, and a prostate blood test done. So that's why it's so important to get the PSA done. Because it's sensitive enough to pick up that something may be wrong, not necessarily always, but something may be wrong before you are getting any symptoms at all.
Is it normal for the prostate to enlarge as men get older? I know you mentioned, you may have to get up and urinate more at night. Is that just a natural occurrence? And to your point, where it may not mean prostate cancer, but it just mean an enlargement, which naturally happens as you get older, or am I wrong on that?
No, you're right on that. I mean, the prostate gland can grow as you get older. And the growth, now we're not necessarily sure what necessarily is causing the increment in growth. Some people's prostate grows faster than others. Some people's prostate actually never grows to the point that they have any symptoms with. But it is something that happens. Prostate cancer, on the other hand, is something that we talked about, that 1 in 6 Black men will be diagnosed, and this is more, it's 1.7 times more than that in white men, about 2.1 times. But the prostate can grow as time goes on. Prostate cancer actually can happen to men if you live long enough. Now, what I mean by that is that when we talk about cancer, it's a sort of a big term, a basket term. There are different cells that are inside this basket. Some cells are more aggressive in terms of prostate cancer, and some of these prostate cancer cells are less aggressive. So in general, if men live long enough into your 80s, you probably have an 80% chance of having prostate cancer, but you're not going to die of prostate cancer. You probably, with people living longer now, but you probably die of maybe heart disease, cardiovascular disease, or something else.
80%, that's a high number, though.
That's
80%.
a high number. Just remember, 80 years old, possibly. But that type of prostate cancer is a slower, less aggressive prostate cancer than the cancer cells that we might find in a younger man at 40 years of age who's hoping to get to be 80 years old. So there are different types of prostate cancers. Some of the cancers are slow growing. Actually, a lot of them are slow growing if caught early, but there are some that are more aggressive. And those are the ones that we'd like to also diagnose and treat.
Kwasi, what kind of reaction have you been receiving by your outreach into the community? What are you hearing? I don't know. Can you hear me, Kwasi?
I can barely hear you for some reason.
Okay, let me repeat the question. I was asking, what kind of response are you getting from the community for your outreach efforts? Sort of what's coming back at you? What are you hearing from the community? Oh, I think we've got a little problem with Kwasi. This is technology sort of buffering, jumping in there. So I'm going to go back to you, Dr. Coleman. When we hear PSA, can you be specific? What does that stand for? What does that mean?
Okay, so PSA stands for prostate specific antigen. So this is a chemical made by the prostate gland, made by cells from the prostate, and also made by cancer cells that we can use to detect in the bloodstream. In general, for men under the age around 50, the PSA should not be higher than 4. And it can be actually stratified by age. When we start screening for prostate cancer, and I'm saying screening, so these are men that have no symptoms, we're just doing screening, we're looking for a PSA in men around 40 to be less than 4. So think of 40 and 4, and sometimes to be even lower, about 2.4, but certainly not higher than 4. I will also like to go back. I think we have Kwasi now, but in terms of how important the community is and the churches are, we just had a prostate cancer walk this past year in Anacostia Park, where the community came out. There were prostate cancer survivors. So these are men who've had prostate cancer and have survived it. And they were there to support each other in terms of walking to educate others about prostate cancer, treatments for prostate cancer, and how they have survived prostate cancer. So the community is important. Having programs like this is important education. There have been other programs on WHUR just talking about men talking about their general health and prostate cancer that are so important in getting the word out there so that people will come in, they'll access their physicians, they'll access friends that may be able to point them the way of a caring person to help them with getting their blood tests done, their PSA done.
Dr. Coleman, why is, we've talked about the 1 in 6 Black men will be diagnosed with prostate cancer yearly, but we also know the mortality rate is double of that of others. And I've even seen some research where it's 4 times as high. I don't know where you fall with those statistics, but whether it's 2 or 4, that's just astronomical. Why is the mortality rate so much higher for African-American men than others?
You know, this is a really good question and a very debatable question. And studies are coming down to that Black men who have prostate cancer, not so much that they have a different disease, but secondary to their access to care early. We've seen even today where the person did not have their PSA done, follow up on their PSA. If African American men can have access to care, get their PSA done, their cancer can be diagnosed and treated, and their cancer is not necessarily different than what we see in Caucasian men. And I will add to that most people, studies are showing that most African American men prefer to be taking care of people that look like them. And they usually get better care from people that look like them, because people that look like them are more concerned about their health in general. So I would say find someone.
Do you think that's unique though, Dr. Coleman, to African American men, to the African American community?
Well, I think in some ways it is unique. I think there are trust issues that go way back in terms of things that have happened in the past, but there are regulations against those things happening in the future. I know we were going to talk a little bit about clinical trials, which again, some people may think, oh, clinical trials is the way that people are going to be experimenting on me. No, that is not true. Okay. Clinical trials are important, and they're important for African American men to engage in these clinical trials, because that's where we're going to learn about the differences in prostate cancer in African American men and the treatments, the medications and things that will be given to see how they affect African American men versus other men. So clinical trials does not mean experimentation. Clinical trials means information that can be given on how to treat your prostate cancer, especially if you tend to have a more aggressive cancer, or that cancer that's not out of the norm, how we would normally treat the cancer at that particular stage. But that we can learn how we can best treat African American men. So the trust factor is there for sure. And the type of physician, you want to find a caring physician for any actually disease that you're looking at, but that's someone that you can relate to, someone that you can talk to, someone that has time to talk to you about prostate cancer.
How do you convince African American men to get involved in trials? Because as you said, we know the history, the Tuskegee experiment, always, comes up, rightfully so.
Yes.
But that has to be a large hurdle, even within the Black community. You work at a hospital that predominantly serves, African-American community. So how do you then convince Black men to sidestep that history and get involved in these trials? And I'm sure, obviously, this goes beyond Black men getting involved in trials.
Yes, it does go beyond Black men getting involved in trials. And I think the one way to do it is education. We need to talk about it. I like to talk to my patients about the fears. What do they know about the Tuskegee experiment, and where have we gone from there? And then get on to what are the positive findings and things. There are treatment options now that actually work better in Black men. There are vaccines and things for prostate cancer that actually work better in Black men than Caucasian men. And so finding out this is just enormous news. I mean, this is great. Genetic factors, being able to do genetic testing. And genetic testing sometimes can just be saliva test. It could be a blood test. If we have prostate tissue, we can send that tissue to look for different markers that can give us a better idea of the genetics of the prostate cancer. And then we can tailor or engineer your treatment based on your genetic findings, markers in your terms of your prostate cancer. So it's very exciting field, I find, and it's a way that we're not guessing on the treatment for your prostate cancer, but we can sort of look at that treatment and say, okay, looking at your genes and your genetics are involved, this is going to be a good medication, or this is going to be a good treatment option for you.
You talked about access early on, and, beyond healthcare, that is such important aspect in the African-American community, access, and access tends to equal economics. And is that what we're talking about? Is that how you see that as well, Dr. Coleman, when you're talking about access to healthcare, access to be able to be screened for prostate cancer? Does economics play a role in having that access?
Economics does play a role, but it shouldn't be a barrier. So I think on the initial screening that all Black men should be able to find a place to get their PSA blood test done and know what that is. Now, after that, if we have to look at further investigation, diagnoses, biopsy, treatment options, things like that, we live in an area, in the metropolitan area, and in Washington, D.C., that there are programs. But the problem is that we don't know about these programs that are available. And so this is where programs like Quasi, #Black Men, or #prostate cancer, or there's FIN programs. There are a lot of programs, believe it or not, that are out there that can give Black men and their families. And this is where the women may come in, because they may be able to help, look up some of these programs and bring their family member in and sign up for these programs and be able to take advantage of them.
Here's where I think it's so important when we're talking about economics and money and how you get folks tested. I think, especially men, and I can, vouch for myself. I can never remember. I know I'm of that age now where I need to have my prostate checked. But I think a lot of men might be confused on, okay, Dr. Coleman, I start when and I go up until when? And do I do it just once a year? I mean, those may sound like very basic questions, but I think a lot of men might not be sure. So can you walk us through when you start, how often, and should you ever stop being tested?
Yes. So very good. So sometimes if you want to start for Black men over the age of 40, okay? It's nice with educating younger people too, but in terms of testing African-American men, and I can't just overemphasize, especially those that have family history at the age of 40. Now, you might decide that, okay, my birthday month, I'm going to test. My birthday week is going to be my health week. That's the week that I'm going to take care of health issues. Or if you want to just enjoy your birthday week, that's fine. But pick a day and stick with that day and make that day your day, your health day, and make an appointment or come to one of the health screenings and get your blood test done. At Howard, we used to screen all the time, always in January, beginning of the year, different health fairs and things that were going on. But now we do screen. We have screening at least once a month. So pick a day and stick to that day. Now the next thing is to know your number. So if I would ask you, what's your PSA? I would want you to be able to tell me what that is. As if I would ask you, what's your cholesterol? What is your sugar? Those who have diabetes probably know what is your hemoglobin A1C. You should know that number. And if that number is a low number, you can be followed, and you can be followed on a 6-month basis. Now, what I mean by low, less than 4. Remember that number 4, okay? If your number happens to be higher than that or close to 4, we might want to see you in a 6-month time period. We look at something called the doubling time or the velocity. So we look to see is that number staying at 4 or is it doubling up to 8? If we see that is the trend, I usually like to repeat that to make sure that's not a false positive, because there are false positives, and I can go through that on PSA. But we want to, or the prostate blood test, but we want to make sure that we're not seeing a trend. If we are seeing a trend, then I may speak to you about additional testing that needs to be done. So having that baseline number is important, and knowing what that number is, and then speaking with your physician in terms of tracking that number. So that's going to be individualized depending upon what your prostate blood test comes back to be. But first thing is to get the blood test done. Get the test done and know what your PSA is.
Dr. Coleman, talk to us a little bit about, I want to know about funding and research. Is there a lot of research that's being done right now in prostate cancer, or do we know pretty much all that we need to know, and especially as it's related to Black men, or does there need to be more research, and is there any specific funding for research prostate cancer in African Americans, or do we know what we need to know, as I mentioned a few moments ago?
Well, we don't know all that we need to know. If we look at every 13 minutes or so, a Black man is going to be diagnosed with prostate cancer. What do we need to know to do about that? Okay, there is a lot of interest, I will tell you, in Black men and prostate cancer, particularly with respect to the treatment options, the medications, and even if you that are available. Nutrition is important. There are vitamins and things that are important, just overall general health. But there's like no known like vitamin. If you take saw palmetto, for example, if you take pumpkin seeds or something, that's going to prevent you from getting prostate cancer. It's going to be you being proactive, knowing what your blood test is, and following up on that. But there are a number of NIH studies. You can go on the website and find those out. We have several studies going on at Howard here, and other universities also are very, very interested in the African American population, as they are in the sickle cell population too, in terms of treatment. Because unfortunately, we have so many Black men that have prostate cancer, right? And so big pharma, big tech companies want to really see, well, how can we make a dent in this? Now, they may benefit in terms of the use of their medications or their drugs or their chemotherapy, different things that they're using, but it can become a win-win situation where once we know more about prostate cancer, and again, the genetics of treating it, like I mentioned, some of the different genes that we can figure out and we can determine, and we can personalize the treatment for that person, for that individual patient, then we're going to really make a dent in prostate cancer and prostate cancer survival in African American men.
Dr. Coleman, what have you found that we know least about regarding prostate cancer? Is there something where it constantly comes up where it's like, folks don't know this where they should know this about prostate cancer? And whether we're talking about, specifically African American men, is there something you find that pretty much goes across the board that's a constant that you have to keep reminding the public and men about regarding prostate cancer?
I think not just prostate cancer, but a lot of cancers, we don't necessarily know the triggers. Now, we know that there are certainly some risk factors, and we mentioned some of them about a high-fat diet, family history, also men who have participated have been a veteran or participate in different wars. There may be certain chemical factors and things that they've been exposed to that we don't know exactly how this cell now decides to become a cancer cell and grow out of control and spread through the body and cause problems. So that is one thing that is being studied. A lot of work is being done in that area. But I will say that probably what we do know is that if you do come down with a cancer of any sort, that if you can fight it, if your body is in the best shape to do so. If you are overweight, if you are a smoker, if you're eating fast foods, if you're not getting rest, if you're not exercising, your body is not going to be in the optimal shape that it needs to be in to fight cancer in general.
Dr. Coleman, what is, we talked about some of the acronyms, PSA, and it's not a public service announcement that people might know of, but there is a PSMA, PT/CT.
Right.
And I think sometimes we can see all of those kind of acronyms and kind of get confused. Is that the same thing as the PSA? What is that? And is that something we should know about?
Yes. I mean, it's not the same thing. So PSA stands for prostate specific antigen. This is a blood test. So blood from your normal vein in your arm that's drawn to see what that is. Now, PSMA PET. So the PSMA stands for prostate specific membrane. So the membrane or the covering of our cells, also that's where we can find prostate cancer cells or just normal prostate cells. And there are tests that can be done. CT stands for CAT scan, that can be done to look for these prostate cells circulating in the bloodstream and being connected to a prostate cell membrane or the layer around the cells, okay? So these tests are particularly done usually once there is a diagnosis of prostate cancer made, and we want to see if the cancer or where the cancer has spread in the body, where these cells, these PSA blood cells, where they're attaching themselves to different cells outside of the prostate. That's what we mean by spread or metastases, where they have gone outside of the prostate and maybe attached them on the lungs or attached them on the liver or inside the bone. Prostate cancer commonly spreads to the bones and also the lymph node tissues. Now, you may not necessarily feel the lymph node tissues, and you probably can't feel the lymph node tissues that are inside of you where the cancer cells will spread. The prostate is inside. It's inside in the pelvic area. It encircles the bladder and the urethra. So that sometimes as the prostate grows, it can put pressure on that urethra or the urine tube where the urine comes out and where you can get the urinary symptoms of enlarged prostate. But the cells are going to be inside the pelvis. You can't feel them, okay? Once they grow out, you may be able to feel them in lymph nodes, different places, but they're inside. So these special tests like the PSMA PET CT scan stands for tests that we can use looking for prostate cancer. Bone scan, looking for cancer in the bones. MRI imaging tests, looking for prostate in other areas. So these are tests that are done when we're trying to get an idea clinically of the spread of prostate cancer.
Well, Dr. Coleman, as we're wrapping up, I would love for our listeners, again, if you have any resources that you think would help our listeners in terms of websites or something that's going on at Howard Hospital. Can you share that with us?
Yes, I would say at Howard University Hospital to look on our website through the Howard University Cancer Center and look up Men Take 10. So it's Men Take 10 minutes to just to look at your prostate health. And then we also have other websites that we will post on there. And we have community programs that are coming up. Like we just had a walk for prostate cancer. It was only, I shouldn't say only, but it was a 1.5 mile walk around the pavilion there out at Anacostia Park. And we're looking at doing some more of these prostate cancer screenings and awareness groups in our community, because that's where we really need to reach our community people and get them out and get screened and get tested for prostate cancer. So I will say, I mean, if nothing else, is that get your PSA done. Know what your PSA is. And let's keep talking about it. And let's keep saving lives, giving people who need to be.
She is Dr. Pamela Coleman, professor in the Department of Surgery and Division of Urology at Howard University's College of Medicine. We also would like to thank Kwasi Neblett. He's the creator of #Black Prostate Check Challenge. at efforts to bring community leaders and policy experts and doctors and others together to fight prostate cancer, especially among Black men. Dr. Coleman, thank you so much for being with us. We appreciate it.
Thank you so much, Mr. Bryan, and thank you to WHUR.
All righty. Thank you so much. That's the Daily Drum for this Monday, September 23rd. I'm Bramante Bryant in for Harold Fisher. Have a great night.